illness per year, with 2 months gap in between, either partial or full remission. There is an important thing because it has got a prevalence rate of at least 1 in 5 or 1 in 6 bipolar disorder person will have rapid cycling mood disorder, and the importance is that it can cause a lot of burden to the person, to the carer, to the individual itself, and the treatment management of this can have its own challenges. So epidemiology, it is quite frequent, and there is two major epidemiological catchment area studies in the US have found that about 2% of the general population have this illness, and the peak onset is between around 20 years of age, with the unlikely age of onset after 40. If an old age psychiatrist like me, people come first time with the hypomanic or manic symptoms, we start to think about organic cause. But generally the age of onset is mainly between 20 years and unlikely after 40. And this will be the typical course of the illness. And the other thing that need to stress, which goes following Professor Duggan's and Dr. Alexander's talk, is that it is a multi-dimensional illness. And McIntyre et al. Could kind of divide that into two categories that are associated with psychiatric problems, mainly substance misuse, impulse control, personality disorders, and they need to be considered in the management of bipolar disorder, and it adds to the complexity. Now there is also, which is associated with physical health problems, mainly diabetes mellitus and cardiovascular problems. Now the importance of this is that some of the drugs that we use can have problems with, can have interactions with the cardiovascular, the drugs that we give for that, and also the antipsychotics that we prescribe can have problems with glucose tolerance and induced diabetes. So it is a multi-dimensional illness, and it just adds to the complexity of the illness. So I won't talk about the acute phase, but this slide will be important because once you've treated an acute phase of illness, the recovery can actually be depends on whether we take it a syndromal level, that means they don't satisfy the criteria of a syndrome of mania anymore or depression anymore. And this study showed that there was actually 98% people recovered completely if we looked at a syndromal level of functioning. Whereas if we looked at symptomatic, that means they might still have some hypomanic or depressive symptoms, the recovery rate fell down to 72%. Now it fell even further, and more than half the person were still not considered as recovery if we took a functional definition role. That means whether they are able to get back to their original level of activity or productivity. So it depends on the recovery that we say, depends on what criteria we take, and it can vary. Now why do we need maintenance treatment? So I shall argue that case based on these three kind of reasons. One is that it is recurrent illness, and the second one is that it has got high risk for suicide. Patients with bipolar can be at high risk, and it also causes big economic burden, not only to the person but also to the society. So after the review concluded that the risk of recurrence in a bipolar